As Saturday marks World Suicide Prevention Day, a message to all: there is hope and help.
There is hope that while we recognize the pain that people experience when they're contemplating suicide, that there are interventions that work. And in particular, interventions that increase our sense of connection and support um, are the most effective.
According to the government, on average, more than 10 Canadians die by suicide daily. And sadly, it's the second leading cause of death for those between the ages of 10 to 29 years old.
All of us can be impacted by suicide. It's something that touches all of us. If you go into a room of people, everyone has been affected in some way.
Dr. Crawford says that historically there's been stigma around this issue, but experts along with advocates have been working hard to remove these barriers and address the risk factors.
We know some of the common risk factors for suicide across most individuals, things like depression and substance use. But we know that different groups can be affected in different ways. So when people don't have their basic needs met, when they deal with poverty or racism or other adversity, that those things can also impact people's people's risk for suicide.
The pandemic emphasized the importance of mental health as helplines saw an increase in calls.
So at Talk Suicide Canada and at crisis lines across the country, we've seen greatly increased volumes. Like our volumes tripled over the course of the pandemic. And those who didn't have as many resources or who faced social adversity are probably disproportionately affected.
For those in crisis, there is help out there. And in November 2023, Canada will be getting a 3-digit mental health crisis line. Anyone who dials 988 will get easy and quick access to services and supports. CAMH is leading the coordination of the service.
I think it's going to really change the landscape of care. 988 will be a game changer. It will, make that service even more accessible.
For City News, I'm Faiza Amin.